So, good morning, everyone. So we'll wait for 2 more minutes as people are going to join. Then we will start. Yeah, we'll start. So thanks for joining. Those who are able to join, and please pass on this link to your friends, colleagues, and relatives because we are about to start. We have doctors who have joined. So thank you so much. So let us, because these are the sessions that we are conducting past 4 weeks, and every Saturday we are conducting session in Telugu at 4 o'clock to 6 o'clock in the evening. And we thought to have, because many people are asking for in English, and I think this would be better opportunity. So where we are going to have on Wednesdays morning at 7:30, and it's till 9 o'clock. We are going to have session in English. So there is no profit and there is no business in this. It's only the social awareness, and where people, these are the times very difficult, where many people and loved ones are in a critical state. So we all have to understand the seriousness of the disease, and not to create a panic, but understand the reality. And at the same time, we want to have a good news where actually we have a vitamin D3 that is actually working in many people, and many people getting recovered from even at the very critical state. So, I mean, why we are having these many sessions? Because let us, take precautionary at the earliest as possible so that we may not get into that critical state. So that is the reason that we are having these sessions. So without not taking much time, so today we are going to have one testimony from Dr. Priyanka, and we have Dr. Banu Prasad Garu and Dr. Vijay with us. So I'll introduce those speakers, and now I want to call upon Dr. Priyanka, where actually she is going to share about her testimony or experience, because she also went past through this effect of COVID, and how she is able to cope up, and how the vitamin D played an important role. So Dr. Priyanka completed her bachelor's of pharmacy from Guru Nanak Institute of Pharmacy, Hyderabad, and later she completed MS in pharmacology and toxicology from New York, Iceland University, and she finished Doctor of Pharmacy from Nova University, Florida. So I mean, as a family, they're staying in USA, but recently they came to India, and now they're stuck with the lockdown. But from this team, when we have these sessions, and we are actually gave some helpline numbers. So at that time, in those helpline numbers, she is also supporting, because she understood how the important role of vitamin D that helps. So we are going to listen some of the cases that she actually guided, and how it got work. So thank you so much, Dr. Priyanka, for joining with us today. And can you please share your experience and the cases that you are actually guiding?
Sure, brother. Thank you. Thank you for
Yeah.
giving me this opportunity. Good morning, everybody. Praise God. Yeah, I am a COVID survivor. My journey with Dr. Banu Prasad Garu and vitamin D3 has started last year around August, July and August. So I've been joining few Zoom meetings, and also I've been watching the vitamin D3 awareness programs in TV as well. So when I was listening to all this vitamin D3 awareness that he has been creating amidst us, it's been very convincing. So it happened to me that I called him and I spoke to him, and the he explained me how vitamin D3 has been helping COVID patients in recovering and the process. And even though I have a medical background, it's been tough for me to accept that truth as well. But I did my own research, and I've been going through research articles, and yes, so whatever Dr. Banu Prasad Garu has been saying, yes, it's actually there. The evidence is there in it's been there since many years. So the protocol that he has suggested, I myself have taken it, and I've also suggested my family members and my friends also to follow the same protocol. And ever since we have been using vitamin D3. And last month, even after I followed the protocol, like even after such huge doses, I've been deficient always. Like my D3 level has never passed 40 nanogram per ml. So I think that's the reason. Last month, I have been affected with COVID, and right now I'm here alive in front of all of you. I've recovered only with vitamin D3. My oxygen, there were days my oxygen levels went down to like 92, and there were days when I took like around 30 capsules of vitamin D3, 60,000 units per day. Um, and also my family members have also been affected with COVID, and have also suggested the same vitamin D3 treatment to everybody, and we've all recovered. Whoever have used vitamin D3, we're all fine. We're all healthy and we're all fine. So since then, I've also started. I've asked Dr. Banu Prasad Garu if I can help others in spreading this awareness and creating this awareness, and he agreed. And I would like to thank him for giving me this opportunity to serve different people and patients. So right now, I would like to present a few cases that I've been observing. Um, so this is case this is the first case. So this patient, he was 34 years old, male. He tested positive and he presented to us on the 7th day. He was using medication suggested by his friend, and he had breathing problem and he had chest congestion, and his CORAD-6 was 6 and the severity score was 12 by 40. His SpO2 readings were 97 and his pulse rate was 92, but even then he had a breathing problem and chest congestion. So what I did was, like, the plan was, I started him on vitamin D3 60,000 units every half an hour for 5 hours, and then followed by 1 hour dosing, and then followed by 3 hour dosing. And then ultimately he was put on the maintenance dose of 4 capsules per day. And this patient is actually, he actually recovered and is doing well right now. So this is a very mild case where he actually was able to catch the, like, this case is where the symptoms were early, and the patient was been addressed in the first week itself. So now let's look into another case. This case, the patient was 73 years old, male. He was tested positive, he was vaccinated. He was not able to eat any food because he was having pain in his throat, and he was having like very little amount of food, like baby amounts. He also had vomitings and he had cough. The time he presented, he had SpO2 oxygen level of 93 and the pulse rate was 101. So the treatment for him was, I started him with 1 hour dosing of vitamin D3 60,000 capsules, and ultimately he came to a maintenance dose of 4 capsules per day. And if we look at the parameters during the vitamin D3 course, now we can see here 95, 94, 95, 95, 95. And ultimately, on the maintenance dose, his oxygen levels came up to 96. And right now, his oxygen levels are above 96, and his pulse rate has also come down. And this patient has also recovered and he's doing very much fine. Now, this is a little bit moderate case. And let's go on to the next case. Now this case, she's a patient, 68-year-old female. She tested positive and she presented to us on the 8th day. Now if we look here, on 7th May, she had body pains, fever, and she had other symptoms. She just bought medicine from medical store and then she took it. But on 10th May, the symptoms repeated. And then she took medicines advised by an RMP doctor. And then 13th May, her rapid antigen test indicated positive. 14th May, she got her CT scan done. And it reported saying it had 20% lung infection. Then she was taken to a hospital with O2 level of 96, and the doctor advised her to stay home and follow quarantine. And then 15th May, what happens was her oxygen levels like dropped down to 93 and 95. And on 16th, like after having a hot water bath, her levels dropped down to 84. And on the same day evening, she was taken to the hospital. 19th and 20th, she received remdesivir and her levels dropped to 80 again. Now on 21st May, she presented to us, and then with an oxygen level of 93 and 86. So if now this, why I'm explaining this timeline here is, if you look here, from 7th May to 21st May, she's been like roaming around with other medications and the preventive kit and everything, but nothing like she didn't recover, she didn't feel well, her oxygen levels kept on just decreasing. Now when she presented to us, we gave her one Arachidol 6 lax injection, that is vitamin D3, And then we started her with a treatment with like every 15 minutes for 5 hours, and then followed by 2 capsules every 1 hour, followed by 1 capsule every 3 hours. And ultimately she was put on a maintenance dose. Now if we look at her oxygen levels, 88 without oxygen support, and then 95 with oxygen. So it's been increasing. Her oxygen levels ever since she started the vitamin D3 treatment, they have been increasing. And right now this patient is still under recovery. She's doing good. Her oxygen levels without oxygen is 93, and with support it's 97. So why I'm presenting this case is uh, just running around for tests to be done and for other medicines. See how much time she has lost, and look at the inflammation that her lungs have developed over the time, which is why it's taking time for her to recover. If only this patient had been addressed before, and if the vitamin D3 treatment had been started before, she would have recovered very fastly. So that is this case. So this is like a moderate severe case. And the next case is this is a patient, 45-year-old male. He tested positive and he presented to us on the 5th day. Now he had breathing problem as well, and he had severe cough. And he presented to us with an oxygen level of 85 and a pulse rate of 105 with a 30 to 40 lung infection. Now during that time, what happened was we started him with vitamin D3 treatment with every half an hour dosing. Um, and then he was taken to because he had severe cough, his oxygen levels actually improved when we started him with the vitamin D3 treatment. His oxygen levels shooted up to 92. But since he had severe cough, his family panicked, and then they took him to the hospital. Now even after hospitalization, his cough did not subside. So he was put on oxygen support, and then they called me back again saying his oxygen levels are dropping, please help us. So I restarted him on the vitamin D3 doses with their permission, and then we followed the same course for him. So if we look here, after he was put on maintenance dose of 4 capsules per day, we kept reducing the doses, starting with every half an hour. His oxygen levels gradually increased without any oxygen support. He was discharged. He came home on an oxygen concentrator. I would like to say that this patient is completely now recovered and he's doing well. His oxygen levels are above 96 and he has a normal pulse rate. Now, all this recovery process started after the vitamin D3 treatment had been started on this patient. So this is another case. It's actually mild, but it developed to moderate because in between, when the family panicked, vitamin D3 administration wasn't done, and there was a huge gap. So that this it progressed to a moderate disease case. And I would like to present the last case. Now this patient, 46-year-old male, he was not tested, but he had symptoms. Good thing that he approached us while he had symptoms. He had high fever and high cough. He presented to us with a oxygen level of 96 and pulse rate ranging from 90 to 120. So then we started vitamin D3 doses on this patient. In the meanwhile, what happened was, one day during the night time, his oxygen levels fell down to 88. Arachidol was given to him. His oxygen levels shooted up to 95. But then later what happened was he became very lethargic. He became very weak. And he thought that weakness was due to vitamin D3. I would like to tell everybody, please just note this point, that weakness and lethargy is a characteristic of the COVID disease itself. It's not because of vitamin D3. I've convinced him a lot, but then he refused the treatment. He refused taking the D3 doses. And what we can see is his oxygen levels went down to like 65, 50 within 5 hours. Within 5 hours, it was like very rapid. It took us so much, like it took us time to get him to 95, but then he refused the treatment, and then sadly, unfortunately, the patient passed away. So this is one of the negative outcomes of not taking vitamin D3, continuously, and refusing the treatment that I've seen in this patient. So the first case was mild, he recovered quickly. Second case was moderate, recovered slowly because he came to us lately. He approached the team lately. Third case was severe. She's still under recovery because her inflammation is more. And the fourth case, as we already discussed, it was mild, but because of the gap, it developed to a moderate disease. And fifth case, it was mild, but again, because the patient refused the treatment, it became severe and the patient passed away. So it's not just these cases. I'm just like I just summarized it to 5 patient cases, but we're seeing a lot of them who've been recovering, who are recovering with this vitamin D3 treatment. It is definitely working, and it is showing positive outcomes in COVID patients. And I myself have experienced it. So I am a live testimony to say vitamin D3 is working. And definitely early detection and early treatment also matters. And also continuous administration of vitamin D3 in these patients helps recover the oxygen levels. And one thing I would like to say is, please don't run around CT scans and test reports. Now there is another case where the patient, he had a CT score of 1 or 2. His RT-PCR came back negative, and then he went to he definitely had symptoms. What happened was, he went to a pulmonologist, and the pulmonologist said, "Oh no, you're completely fine. It's not COVID. You just have a normal viral fever." And then he just gave him some medications for that cold and cough, and he sent back the patient home. Unfortunately, 10 days later, all his symptoms did not decrease, and the condition just became worse. And he got another CT scan, and the disease progressed to um, 10 by 25. And when he went to the pulmonologist, what the pulmonologist said was, "Oh, you need immediate admission. You have COVID." So what I would like to say is, please don't run around these CT scans and test reports. When you have symptoms, just start vitamin D3 right away. That will help you from not being hospitalized. And any person of any age can take it, no matter like what comorbidities the patient has. So this is, I would like to conclude. I would like to really thank you, Dr. Bhanuprasad Garu, and team for giving me this opportunity to serve different patients, COVID patients. Thank you, Prakash Garu. Thank you so much.
Thank you so much, Dr. Priyanka Garu. And that was really, good presentation where you have given, all the stats, how actually the patient was treated. And yeah, by the way, to the participants, so there is no consultation. It's purely voluntarily and as the need of the society, that where we can give something back to them. And that's the love of God. And definitely we have to call out that. And as we are seeing those cases, right, the last case when she said that he refused to take vitamin D3, and that caused a huge damage, and which I mean, it's irrecoverable. So I think what we have to understand is, as she go through that use cases, right? So whoever actually took that, and they're able to recover, and and they have a good health. I mean, there some of the people are in a recovery mode. So thank you so much, Dr. Priyanka, for sharing that. And yeah, so now we are going to have a few things that we are going to talk today. So one is mainly how the disease is actually progressing in a person once he is affected. So I think understanding that particular disease, the problem, we can't understand the solution, how actually it takes place. So that's why we're going to have some discussion on how the coronavirus inside our body, in which phases that actually progress. So those things we're going to have, one point discussion, and second one is like um, black fungus, because some people talking about black fungus and white fungus and yellow fungus. So why actually the fungus is coming into our body? Is it COVID or something else that is causing? So those things we're going to have, and participants, you can actually raise your hands, and as the discussion progresses, we'll give some time to question hour. Parallelly, you can just raise your hand. I'll unmute so that you can ask the question. So today we are having Dr. Banu Prasad Garu with us, and as many of us know, that he completed his post graduation from Hyderabad Central University, and after that he did his PharmD from Creighton University, USA. Now he is a president for Long Beach Chemist in New York. And thank you so much, Dr. Banu Prasad Garu, for joining with us. And we have Dr. Vijay, completed MBBS and AFIH, and he's working as an occupational health physician in one of the MNC in Kakinada. So thank you so much, Dr. Vijay, for joining with us. And we have Dr. Priyanka as well. And as the discussion progresses, and any of you just, you can interrupt and add your points as the discussion progresses. So thank you so much. Now I request Dr. Banu Prasad Garu, please share us, how the disease, progresses once a person affected with COVID, and in which phase, how many phases that actually it get, to severity, and what are the current mechanisms or a treatment that is actually, happening, and how vitamin D3 play a role in all those phases. So can you please, help us and walk through us so that it will be helpful to many people.
Okay. Thank you once again. Thank you for the opportunity to be among this meeting, among all the people, and also thank you for all the people who have joined. And there are many professionals here, and thank you for your interest. And also, if you've been following any of these meetings for the past few months, almost up to a year, you know exactly where I'm coming from in this with respect to this illness. And I think we have discussed many times how this illness progresses in a COVID patient. So yes, and we have, there is a specific way this progresses. This illness progresses once the person is infected to a point where the person is experiencing this desaturation, or the oxygen levels going down, and that is and also this disease presentation is different in different people, and it is different in different societies, and this is the reason why this illness is such a complex illness, and people who are seemingly well, and within no time they progress to they progress to almost a fatality within no time at all, and that is what is an extremely troubling aspect of this disease. And even with oxygen support, even with people people in hospitals, what we see is, as soon as they go to the hospital, they go to the hospital at a very critical stage, and they start progressing from there to more increasing oxygen demand, and they're put on 5 liters and 5 liters to 10 liters, 10 liters to 15 liters, and then they go on to BiPAP, the high pressure, and also they go from there they go on to ventilation, and some people don't recover at all from this. And what we need to look at is, we need to understand, as Prakash mentioned. Yeah, go ahead.
I think some people are actually, saying voice is low, volume is low.
Okay.
Yeah.
Can you hear me, Prakash?
Yeah, actually, I'm able to hear clearly.
Okay. I don't know what I can change here with respect to my settings here.
Yeah. I think it is clear now. Maybe you can proceed, sir.
Okay, let me take a look. Just a moment. Let me see if I can change anything here. Okay. If you can hear me, yeah, if you can hear me, we can proceed. Okay. So first of all, the proper understanding of this disease is very important. Okay, and on the modalities that we use, yeah, we need to understand if they are working. If they are not working, we need to be very careful in administering them to the patients, and with the full understanding that they will not work. Okay, and that is the dilemma that every clinician is facing at this point. And also, there are conflicting messages, conflicting recommendations from various groups, various organizations, for instance, WHO. And from the beginning, there are so many things that were recommended, which those recommendations have changed over time, and even on a daily basis. Okay? And some of which are still being used even to this day with respect to antivirals and remdesivir and plasma therapies, or are high dose steroids. And we need to understand how these things are working. And also, Prakash, would you like to put up that graphic so we can talk about that, please? Okay. First of all, here what we see is from the time the person is infected to the time this hyperinflammation occurs in the lungs, and that hyperinflammation starts shutting down the lungs. Okay? And it starts affecting the gas exchange surfaces in the alveoli, or in the lungs, the functional unit of the lung. Okay, here what we have is the first few days, about first few days, patient is almost asymptomatic. Our patient has very mild symptoms. This is when this viral response phase. Okay, this is where the virus is replicating rapidly. Okay, in the lungs, even in the mouth and the nose. And there, we have the patient has very mild symptoms, like the sore throat, or a little bit of a little headache, or little cough. Okay, this is the phase. Okay, from there it progresses to pulmonary phase. Okay, this is the first 5 to 7 days, and after that you have this pulmonary phase. During this pulmonary phase, the patient develops something called pneumonia. Okay, this is where the CT scans, HRCT scan, that is where it turns positive. And in the first phase, when we take a look at the HRCT in the first phase, the lungs are not involved at all. Okay, there is no, and there won't be any inflammation in the lung. Okay, this is where once the pulmonary phase starts, that is when the inflammation in the lungs begins. And once that begins, that is when things start becoming severe. Okay, and here in the stage 2, what we see is the patient is developing cough, and patient is slowly getting desaturated, and they have more symptoms, and probably fever, and various other symptoms, the respiratory symptoms. This is when the HRCT turns positive. So here the problem with HRCT is, depending on the phase of this, where this in the stage of this illness, okay, HRCT might show almost no involvement of the lungs. Okay, can we conclude that this patient is not going to progress further? No, we cannot. Okay, and in the stage 2, the HRCT shows 3 out of 25. That is very mild stage. Can we conclude that this patient will not progress to 20 out of 25? No, we cannot. Okay? And also this progression happens very quickly. Okay, and that is the reason why many patients who are admitted to the hospitals, who are put on oxygen, and even though they are desaturating and put on oxygen, and they come, their oxygen levels recover on high flow oxygen, the FiO2 of 100%, and put on any mask. Okay, their oxygen recovers, but the underlying process that is going on in the lungs is continuing. Okay, and they progress from 3 out of 25 to 4 out of 25 to 20 out of 25 and 25 out of 25. And that is the reason why within 4 to 5 days, going from 3 to 25. So what good is it getting an HRCT at a point of time where it shows mild inflammation, and from there it progresses to very severe inflammation, and the patient is failing all the while we are supporting with more and more and more and more more support of oxygen. Okay, so you see the point here. The problem is the oxygen is not the cure, and also all the modalities that are being used in the hospitals, okay, and they're not helping certain people. That is what we need to understand. So you have this stage 2 pulmonary phase. This is where the patient is developing pulmonary symptoms, and even here patient will not feel anything, and their saturations are fine. When we taught everybody, look at the oxygen level. If it goes below 92 or below 90, then go to the hospital. That's what we told them, and that is exactly what people are following. Okay, but what we need to understand is what is causing this desaturation during this pulmonary phase, and when it shows up as 4 out of 25 or 5 out of 25, are we misreading the HRCT? Okay, when we say it is infection, are we treating this as infection while this is inflammation? Okay, so from the beginning, what we have told is this. Okay, this is where the viral response phase. Okay, you have this viral response phase, and virus is slowly, once the immune system is activated, the virus count goes down and down and down, and virus no longer becomes an important part here. It is our own immune system which is activated, and that is when this is in the middle stage, in the pulmonary phase. The immune system is activated. That immune system is responsible for this inflammation that is caused. Okay, can you see the point here? If that immune system is causing this inflammation, if we read that as infection, and if we apply remedies for infection while it is the inflammation, then we would have done the wrong thing, and that inflammation would continue to rise while we are trying to treat the infection. That is what is happening in most of these patients who are failing. Okay, and then from there it progresses to this hyperinflammation phase, okay, where this extreme inflammatory response from the body, which is that inflammatory response is coming from the dysfunctional immune system. When that dysfunctional immune system is generating all these inflammatory cytokines, which are intended to fight against this invading organism, and those inflammatory cytokines, they start affecting our lungs. They start completely destroying the lung tissue. That is where the real problem is. Okay, and now let's look at the treatments that are being applied at each of these stages. Can you go to the next slide, Prakash? Okay, beautiful. So now we have this viral replication stage. Okay, and here patients are asymptomatic. Patients do not have any symptoms at all. Okay, they are asymptomatic or mildly symptomatic the first 5 to 7 days. Okay, and you may have a little fever, cold or cough, and body pains and headache, which are being treated by taking a dolo. Okay, and by taking a dolo, we are able to bring down the fevers. We are able to bring down these mild symptoms. But is that bringing down what is going on inside though? No, it is not. No, it is not. Okay. Now, when we look at antivirals, okay, antivirals are effective when the virus is replicating at a rapid rate. That means there is viral replication happening at this stage. Okay. And that is when the antivirals, that is when remdesivir could be effective. Okay. And other antivirals could be effective. Okay. So now from there, it just progresses. Okay, so you have the immune response. Okay, once this viral proliferation happens, viral load is increased, and that is when the immune system gets activated. Okay, once the immune system gets activated, it is, I think the viral replication is done. I think virus is no longer replicating, and virus is dealt with by this immune system. This is where if the immune responses, so we have two branches in the immune system. One is innate immunity and the adaptive immunity. So innate immune responses are important, adaptive immune responses are important. Okay, this is where from the innate immunity, okay, if everything works properly, okay, and we know, you all know, if you have attended any of these seminars, okay, you know that For innate immunity to function properly or adaptive immunity to function properly, you need vitamin D. Okay, and here in the viral replication phase, vitamin D3 also is important because for a virus to replicate, it has to use the cellular transcription mechanisms, which are controlled by a nuclear receptor called vitamin D receptor. Okay, if the vitamin D receptor is not occupied by its complement, which is vitamin D, and these cellular replication mechanisms can be hijacked by the virus for it to proliferate what is extremely fast. Okay, and there is documented evidence that if vitamin D levels are proper in a host, in that host, the viral replication is curtailed, viral replication is contained. So vitamin D works in this viral replication phase as well. Okay, this is where, when the virus is proliferating fast, and that is where antivirals can work, and vitamin D works there. And during the cytokine storm stage, and vitamin D works well because it modulates the innate immune responses, where it upregulates certain compounds which are antiviral, okay, which can take care of the virus very well. That is the first line of defense, the innate immune responses. Okay? That innate immune responses are properly modulated and properly controlled by proper levels of vitamin D. Then we come to the adaptive immune response. Okay? Adaptive immune response, this is where most of the inflammatory cytokines come from. The inflammation comes from here. So now, if there is enough vitamin D, proper levels of vitamin D in a person, okay, and their immune system is working properly, that is when this immune responses, this adaptive immune responses progress towards all these immune responses shift towards anti-inflammatory branch of this adaptive immune system. So that means these both branches, inflammatory branch and anti-inflammatory branch, they both have to function in balance. Okay, if not, you have a dysfunctional immune system, and we have a problem. And that is where this cytokine storm happens. These cytokines, they're supposed to be modulated properly, but they go out of control and they start affecting the gas exchange surfaces in your lungs. And that is where the desaturation happens. And after that, we come to, so here in the cytokine storm stage, what we have is we have antibiotics and we have steroids that are being used. Okay. So now in the cytokine storm stage, what we read or misread this as an infection, while this is inflammation that is resulting from the immune system that is dysfunctional. Okay, do you see? Okay, proper reading of the disease, a proper understanding of this disease is important to properly administer the remedy to this disease. So vitamin D works even in this stage also. We have seen many people, we have measured this IL-6 in people where IL-6 is in triple digits and patient is actively desaturating. Okay, this is called the active phase of this illness. Okay, and we administer vitamin D in proper doses. In one day, the IL-6 comes down from 100, triple digits to single digits, and patient saturation recovers. Okay, so that is this stage, and you have this hyperinflammation stage. Okay, and where you have this inflammatory cytokines are just going rampant, and patient saturation has fallen down to very low levels, and you have other inflammatory markers that are primary inflammatory markers IL-6, and there are secondary inflammatory markers. There's a ferritin, D-dimer, and LDH, and other inflammatory markers start going through the roof. This is the hyperinflammatory phase. Okay, and if we do not address the problem in these two stages, patient will progress to hyperinflammation phase. And some people do respond to the high-dose steroids, but the problem is the high-dose steroids there is something called neutrophil upregulation. These neutrophils can be a trouble at a later stage. We will come to that in a little later. During this hyperinflammation phase also, okay, and this is when we start administering, okay, in the hospitals, this is where we start administering various remedies here. Remdesivir is administered here. Okay, and there is no viral replication has stopped a while ago, and here this is where we are administering remdesivir in the hopes that we are able to contain this infection, okay, which is nothing but inflammation, and we are administering remdesivir here, which is not effective. And that has been said by this fact has been validated by the WHO and also even ICMR, and there are several prominent doctors, okay, who have said that, the same fact. Remdesivir in severe cases is not effective, and there are so many published papers in the last year that remdesivir in this stage is completely useless. Okay, and what about plasma therapy? Plasma therapy, you have antibodies that are gathered from a patient who has recovered. This convalescent plasma is given to a person who is in this stage, and you know what? That also is ineffective, because these antibodies seek out this active virus, and that kills that virus, and virus has been taken care of by by your own immune system and all these raging cytokines, and plasma therapy is ineffective. What about vitamin D3? Okay. Vitamin D3 is effective even during this stage, and we have been able to see, we were able to witness even in severe stage where patient is actively desaturating. We were able to see just properly administering vitamin D, we were able to, the saturations will return to normal. But as Dr. Priyanka mentioned, continuous administration is very important, in the active phase of this illness. Okay, because we don't know. I think we will come to these mechanisms by which vitamin D helps this process. Okay, but vitamin D, within 15 minutes of administering vitamin D, we have been able to see the saturations return to almost 10, 15, 20, 30 points recovery. Okay, and also we have seen this D-dimer levels fall from almost 8,000, 9,000 range to almost 500 or less within a matter of 24 hours. Okay, and same thing with all the other inflammatory markers. Ferritin. Ferritin is responsible for causing so much damage to the lungs. That is free iron that is running around, which is toxic, which causes so much oxidative damage and to the alveoli and to the lungs. Okay, and those also we have been able to witness them coming down as well. Okay, so here, and then what we have is delayed cytokine storm. After this, once patient survives this, patient is being administered extremely high dose steroids during all these phases, and all these high dose steroids, they are slowly taking their toll, and there is slowly neutrophils are going up, and neutrophils are going up and up and up and up. And then you have the cytokines that are released from these neutrophils, and which is responsible for the delayed cytokine storm. Okay? You have patients who are who are recovering, who seem to be recovering on high dose steroid therapy and all these therapies, and suddenly it hits. Okay? And their IL-6 is down, their inflammatory markers are down, but again, after seven or 8 days, then on 10 days of this high dose, steroids and all those things, and then these inflammatory markers going up again. IL-6 is in triple digits again, whereas it was in 100 or 200 range, and it comes down, and now it is going to 600, 700, 800, 1,000. Okay? And D-dimer is going beyond 10,000. This is where the patient is progressing from. This inflammation is progressing beyond the lungs, and it is going to other organs. This is where multi-organ failure is a reality that we need to face. So here, does vitamin D work here? Absolutely, it does. It controls the cytokines which are getting generated from this. The vitamin D can modulate the cytokines that are generated from neutrophils as well. Okay, so vitamin D works in all phases of this illness. There is documented evidence that vitamin D modulates our immune system. Okay, so vitamin D works in every phase of this illness, and most of the, as we know, and if we do not understand this, if we do not read, if we read this inflammation as infection, that is what prompts us, from prompts us to do therapies that may or may not work, or that may predispose the patient for for worsening disease process later on. And also, one word of caution here. Okay, a lot of doctors, okay, are administering what is it, methylxanthines like derifilin, aminophilin, or acibrophilin. Okay, these are, they work for asthma, but they don't work for COVID. They don't. And most of these, these methylxanthines, what they do is they cause the pulse rate to go up uncontrollably. And if people are given these in severe stage of the illness, their pulse rate goes up to 170, 180, even 200, and you cannot control this. And people can just proceed to, and what is it, moderately stable patients can proceed to a fatal event within a matter of minutes after administering methylxanthines. So we need to understand what this disease is. We need to understand different stages of this disease. We need to understand what is responsible for these worsening symptoms during each of these stages. Okay, then and only then we will be able to properly administer a remedy that really works. So I hope this is this is clear, and we will go on to the next. Prakash, over to you.
Thank you so much, Banu Prasad Garu, for explaining all the phases. And here I just want to, Dr. Vijay Garu, if you want to add anything, because this is one of the important related to COVID disease. And if you want to add any points to that.
Yeah, sure. Yeah, I would like to just share briefly. I mean, in a medical perspective, in a deeper way. Okay. So, yeah. Yeah. There are, I mean, as Dr. Banu Prasad Garu has already told, I mean, there are 4 phases. I mean, the viral phase, the cytokine storm stage, and the hyperinflammatory phase, and the recovery phase. Different phases we see actually. So these all main pathophysiology, if we see actually medical perspective, there are 4 ways which our lungs get destroyed or the various parts of our body get destroyed. One is whenever the virus comes and attaches to the cells, I mean ACE2 receptors, the virus kills the cell directly by replicating, I mean, by replicating the cells, and thereby, I mean, oozing out the cells out of the cell directly, thereby killing the cell and the adjacent cells. So this is one way. And the second way is the natural killer cells which come and which identify these infected cells and destroy them. And the third way is like the cell system is inhibited. Actually, cell system, if you see, it gets inhibited, and the ACE2 enzyme, if you see, I mean, the ACE2 enzyme, it is destroyed by the virus. Actually, if you see, I mean, I would like to just show the renin-angiotensin mechanism actually. So if you see this mechanism, this is a beautiful mechanism actually. So whenever there is renin released, I mean, the angiotensin is converted into angiotensin 1 and the angiotensin 2. So what happens is you just concentrate on this ACE2 receptor. This ACE2 receptor is destroyed actually. If it is destroyed, there will be only the production of angiotensin 2. Okay, so what are the properties of this angiotensin 2? What it causes if it increases in your body? So it causes vasoconstriction. It is mostly pro-inflammatory. I mean, it increases various cytokines, which increases the inflammation, and it is fibrotic and also thrombotic, thereby forms the coagulation. Okay, So if you see, I mean, body has a very beautiful mechanism where this angiotensin 2 in higher levels is converted to angiotensin 1 and 7 and 1 and 9, thereby modulating it. So what does angiotensin 1 does? 1 to 7 does vasodilatation, anti-proliferative, and anti-inflammatory, and anti-thrombotic also. So what happens when the virus destroys this ACE2 receptor? So whenever it destroys the angiotensin 2 is naturally it is increased. So here vitamin D plays a very important role actually. So vitamin D, I mean, it decreases the renin angiotensin mechanism, thereby preventing this angiotensin to form more, thereby preventing this all the pro-inflammation, hyperinflammation sequences which are going to take place. It stops it actually. That is one beautiful mechanism which vitamin D does. And the third is like usually we see, I mean, whenever the whenever more, I mean, inflammatory mechanisms come in to take place, we see the macrophage, activated syndrome, or the cytokine storm, which brother has already explained. I mean, there we see, I mean, destruction of the lung in a sequence way. In a first phase, we see that there will be atypical pneumonia, where, I mean, the saturations are not decreased. The patients feel well, but where the cell, I mean, we don't see any hypoxia in that stage actually. There won't be, I mean, hypoxia in this stage. What happens in this stage is there won't be any oozing of replicated cells outside the cell. So that's why there won't be any hypoxia. This converts into typical pneumonia, where in typical pneumonia, we see the cells come out of the cell, various inflammatory markers come out of the cell, and the lungs are destroyed. Thereby, it leads to ARDS, acute respiratory distress syndrome. In a later stage, we see this actually. So here the patient requires oxygen levels actually. So oxygen, I mean, it tries to regenerate the cells in this phase. In this way, so it's very important. Also, we see many patients are in prone position. In ICUs, we see many patients, they keep him in prone position, thereby, I mean, expanding the posterior surface of the lungs, thereby increasing the oxygenation in the lungs. So the other thing is where it plays a pathophysiology plays a role is the immune dysregulation. The immune dysregulation is like people will be, their immune system will be dysregulated for a long time. If you see, I mean, there will be already in dysregulated state actually. So thereby, I mean, there will be viral resistance. I mean, even vitamin D in sometimes in some patients we have seen it is not working. We have seen that actually giving long doses and continuous administration are proved to be, good in those patients actually, we have seen. And I would like to just share one more thing. Yeah, this is what I want to add, Brother Prakash.
Okay. Thank you so much, Dr. Vijay Garu. So maybe in a medical terms, we understood and we had a lot of information on the disease. And let me, put in a layman terms, where actually I'm not from a medical background, but let me put my thoughts. Maybe, sir, you can correct me if I, take a different path. Okay. So let me share my screen. So I think as it was discussed, how the disease getting progressed. So we have this incubation or replication phase. Once the virus enter into our body, and that is the time where it may take some 5 to 10 days. It is in the replication phase. So the virus will get multiplied, and it'll grow like anything. That's what we call a virus load. So once this is happening, so in this phase, some people may have light symptoms. They may have fever, or they may have a cold or cough, light cough, or sometimes dizziness. I mean, we don't feel like, heaviness in this phase, and that is the one of the, deceiving, area by this disease, because we don't feel anything and we feel like we are in a normal condition. And because we were not able to understand the disease, and by the time we come to know and we enter into the cytokine storm phase. So cytokine storm phase means, so once we have that virus, right, so our immunity system get activated, and the virus will be get eliminated from the body. So that means there is no virus inside our body after few days. And after that, if you go for test, when you're in the cytokine storm phase, you may get negative result. But the problem is disease has started the severity from cytokine storm phase. And this is the phase where we have this severe cough, and even oxygen levels getting down, or pulse may go up. And this is the phase where we have a lot of criticality. And if we can't administer properly, then that may leads to heavy damage. So that's where, so even in the remdesivir, as actually doctor said, this can help in stopping the replication. That means the virus, while it is replicating, if we give remdesivir, maybe it will be helpful here. But by the time we come to know that we have some problem, and almost 2 to 3 days already passed by, and it has already some replication, virus load is there. So, and many people actually taking remdesivir in this phase, after admitted in the hospital, oxygen levels got down, and pulse got increased. So there is no way that helps remdesivir. That's what we have been, even one of the chemical engineer that he mentioned in the YouTube channel also, I read. So I saw that. So remdesivir will not work in this phase. And second one is that the treatment that we are getting is the steroids. Steroids actually may help in order to suspend the immune system. So let me share one video of the cytokine storm that really pictures very well. Let me share this. You're able to see video? Dr. Vijay, can you confirm? Is it visible?
Yeah,
Yeah.
Unmute the.
Yeah, it's visible.
Yeah.
Response, including macrophages, dendritic cells, natural killer cells. Response
So if you look at, right, so when we have virus, and slowly
requires
our
the
immune
activation of the inflammatory pathways of the immune
system will
system.
activate, and it will come.
Cytokines are produced by immune cells that are part of the innate immune response, including macrophages, dendritic cells, natural killer cells, and
So these are our immunity cells that actually generating these cytokines. Maybe we can understand like some kind of chemicals that is actually releasing from these cells.
the adaptive T and B lymphocytes. An unchecked and overexuberant immune response, known as a cytokine storm, can lead to irreversible tissue damage. This has been recognized in severe and critical COVID-19.
So this is the phase as we mentioned, right? So after the replication phase, once the immunity system activated and it started releasing these cytokines inside our lungs, and the huge cells of this our immunity system generating these cytokines that actually piled up our lungs, and that's where we see that like a kind of pneumonia and the phlegm that is actually coming out of our when we are coughing. So if this grows on, and that's where we feel tightness in the lungs, and we are not able to take breathe, and slowly the oxygen levels getting down, and that is the phase where we have to have the severity of the disease. So if you look at the steroids, right, so they'll actually pause these cytokine, these immunity cells to pause for some time. So if they pass, and we will feel like oxygen levels getting little stable, and we feel little comfortable. But that is only the pause, that the cells were suspended. But after some time, again they will be activated, and a huge cytokine storm will goes on. That is what we are calling as a delayed cytokine storm. If you look at delayed cytokine storm, that means because of steroids, it was paused for some time, and slowly that cytokine storm again get generated, and that is where the real damage has happened to lungs. So if you look at vitamin D3 helps, right, in all these phases, in stopping the replication phase. How it will stop the replication phase? Because in each immunity that cell we can consider like there is a locking mechanism. So vitamin D, if vitamin D is there, it will lock the cell. So the virus will not enter into our cell and it will not modify the transcription mechanism. So if vitamin D3 is not having sufficient levels, and cell easily can enter into our cell and it can modify our transcription mechanism, then it will replicate. So vitamin D will lock that particular replication. That will be helpful. And in cytokine storm, as Dr. Bhanu Prasad Garu told, like it will helpful in that adaptive immunity system, where actually it will stop that cytokine storm. And in the restoration also, once we have this high load of virus and the damage, and vitamin D will start repairing the cells, and it will helpful. And let me play that video as well, because that is very helpful. So it will take only 1 minute. Just give me a minute. Yes. So how vitamin D will work inside our body? So this particular video was prepared by just like for cancer.
My name is.
Have created this video, but this helpful even understanding in COVID as well.
Okay, so hundreds of studies have shown how vitamin D can prevent as many as 30 different kinds of cancer. But how does it work? Well, here's the thing. Vitamin D is actually a hormone, and its primary function is cell management. Yeah, in fact, more than 90% of this important hormone is created when your skin is exposed to UVB light. All right, so check this out. Throughout your body, millions of cells are constantly reproducing, right? Every one of these cells has a vitamin D receptor, and for good reason. Occasionally, something goes wrong with the cell and it mutates. When this happens, vitamin D plugs into that cell and sends a message to the nucleus telling it how to repair itself. If the cell cannot be repaired, vitamin D tells the cell how to destroy itself. That way it won't multiply and spread throughout the body.
Yeah, that's one of the good point. So in every cell, we have that receptor where once vitamin D, we have sufficient levels. So when it occupies that cell, and if there is any, misbehavior of the cell, it will correct. If it is uncorrectable, then it will say that destroy yourself. So that's how the, malfunctioning cells will be eliminated from our body. And yeah, look at just one.
Okay, so take a second and imagine what happens if your body doesn't have enough vitamin D. Yeah, the mutating cells multiply uncontrollably and can spread throughout your body. But hey, wait a second. If your body has enough vitamin D, it can fix or destroy those mutating cells before they multiply and allow the disease to take hold.
Yeah, so that's how, once we have sufficient level of vitamin D, even though the virus that get multiplied, but it will eliminate in order to get to the stable condition. So I think that is one of the, beauty of vitamin D3, how it helps. So maybe if anything, Dr. Bhanugaru or Vijay garu, if you want to, correct me if something, if I totally, deviated to that point.
Yeah. I mean, as you said, I mean, it plays a very, very important role in all the phases, whether it is viral replications phase or cytokine storm stage, or I mean, even in the hyperinflammatory phase also. It plays a very, very important role actually. So there are many studies also and articles we see there where which they explain the antiviral properties of vitamin D, where it maintains the epithelial integrity also. I mean, thereby preventing the virus to enter. we see that, I mean, it also has, I mean, clot prevention properties, thereby preventing clot. We see that. I mean, if we see, I mean, as I was telling about angiotensin 2, so whenever it attaches to the receptor, AT1 receptor on the cell, so what happens is there is some reactive oxygen species which is produced in the cell, which destroys the cell. So here, I mean, there the inflammation starts actually. So that is the trigger of inflammation. So vitamin D, we see that it plays a very important role in decreasing the angiotensin 2. I mean, yeah.
Yeah. Thank you. Thank you so much, Dr. Vijay. So let's take 1 or 2%, then we'll go for the black fungus and we will conclude maybe. So participants, if any of you have questions, you can just raise your hand. I'll unmute so that you can ask questions. You can raise your hand in the chat, in the Zoom. Okay. So Sridhar. Sridhar Nimmagadda. Yeah.
Good morning and good evening all. Yeah, I actually went for a vitamin D3 blood test and my vitamin D3 level is 29.6. So, which is almost, I think the normal range is between 30 to 70. So do I need to still take the vitamin D3 capsules because it is already in normal range? My blood report says it is already in normal range. Do I still need to take the capsules or I'm okay? I'm good with the immune system.
Okay. Well, that's a good question. So according to Institute of Endocrine Institute, the acceptable level of vitamin D is 30 nanograms per ml to 100 nanograms per ml. But the problem is, that is a broad range. Okay, and that 30 nanograms per ml, it was, that range was a long time ago, when vitamin D is understood to be only, part of our, calcium metabolism. But later on, okay, this immunomodulatory effects and all the, gene expression modulatory effects, and also vitamin D being instrumental in controlling so many physiological processes, all that research came after that, and we have never revisited that range. Okay, and also there are so many studies which prove that when your levels are between about 60 to 100 nanograms per ml, that proved to be protective in the previous coronavirus outbreaks, like SARS and MERS, SARS in 2002 and MERS in 2010. Okay, so vitamin D level, maintaining vitamin D levels in this pandemic, okay, between 80 and 100 nanograms per ml is absolutely positively essential. Okay, and also, do not think that, just don't take this these doses 2 times, that we are suggesting, that 2 times a day for 7 days and immediately go for a test. Okay, immediately you will get a very false high results, which may say that you're toxic, but that is not the true reflection of your vitamin D levels. Okay, vitamin D levels, and just take this and go to weekly dosing for next 3 months and get tested. That will give you a true measure of where your vitamin D is. And also, if your immune system has been dysfunctional throughout your life, okay, and just increasing your vitamin D level to a point where it is 100 now, and expecting your immune system to work properly is expecting too much. Okay? Your immune system takes time for it to be trained in a high vitamin D environment. Okay, those immune responses have to be trained. That is what we are doing with respect to treating these COVID patients who are severe. We are giving constant inputs of vitamin D and bringing back these immune reactions, from inflammatory pathway to anti-inflammatory pathway. And that is why constant input of vitamin D during the active phase of illness is important. Yeah, to answer your question, if you're 29.6, that is still deficient. And I would take corrective measures to bring that level up to between 80 and 100 nanograms per ml.
So, Mukesh Chandra garu, can you ask your question?
Yes, sir. Please, sir. Yeah, sir. By 20 April, I start getting dry coughs, and I did not take it seriously. But by May first week, I started getting fever, body pain, and all that. So even then, I did not take it seriously. I took some homeopathy medicines when there was no cure for 4 or 5 days, sir. Then one of my friends suggested me to take some allopathy medicines, and I took 6 days course. Fever came down, body pain came down, but sir, then I started getting dry cough. It was increasing and increasing, and on 23rd May, I took my pulse and oxygen rate. So oxygen rate was going up to 93, 94, but pulse rate was fluctuating. It maximum it went up to 126. But from 24 May, I started taking vitamin D3 capsules for 6 days in the interval of an hour. Then heartbeat came down up to 80, 76, 95, and yesterday it was heartbeat was 90 and 83, something like that. Now, sir, I am worried about whether my lungs have infected with what you call pyrosis or something like that, because dry cough is not uh, stopping, sir.
Okay.
And one day I noticed that when I cough, some 3-4 blood droplets were there, and before 2-3 days, my throat, I don't know, some tissues or any nerve got destroyed. Some 2-3 times, some little blood came out. So I'm worried about this dry cough, whether my lungs are affected with lung pyrosis disease or something like that. Please suggest.
Okay. Yeah, Mukesh Chandraji. So the thing is, you're talking about fibrosis, okay, pulmonary fibrosis, okay, and if there is inflammation for any length of time, which is not properly addressed, then your lungs or the gas exchange surfaces will become thicker, and that is called pulmonary fibrosis. And when lungs become fibrotic, that can affect the way your lungs exchange the gases, carbon dioxide and oxygen. And also, if what is your saturation, if I may ask? You're muted, Mukesh Chandraji. You're muted. You're on mute.
Sir, on 23rd, it was oxygen level was 93, 90, 94. It touched up to 96. And heartbeat was 105, 103, and it
Okay.
touched it up to 125, sir.
What is it currently? What is it currently? What is it now?
Currently, sir, 84, between 84 to 95 oxygen level, and pulse rate 90, between 90 and 83.
Okay. Yeah. There is a way that we can address your, if there is some fibrosis, and if it is an acute stage, it can be properly addressed by, and one of the remedies, one of the things that I'm suggesting is if you take the egg yolks, if you have the eggs, separate the yolks, separate the yellow, and consume it raw. Okay. And egg yolks have a lot of phospholipids, and also they have lecithin, which can supply the surfactant that is required for this alveoli and the gas exchange surfaces to work properly. So, and we have seen in the late phase, when we are able to get to the patients in the late stage, and when they recovered, and this is what has worked well. The low doses of vitamin D, not very heavy doses, because you're already past this active phase of this illness. And so just a few doses of vitamin D along with raw egg yolks can bring back the lung function to its normal level. And also, if you have, this is a very hyperinflammatory disease, And if you have a little bit of blood or a little bit of brownish spots when you're coughing out sputum, I would not be worried about that. But if you have fresh blood, okay, just get yourself checked out by a gastroenterologist or some doctor, because if you have esophageal varices, okay, that can be a problem. Just get yourself checked out, okay? And if you have blood coming out, and if it is going away, that's okay. And if the persistent cough can be addressed by nebulizing with normal saline, with 2 drops of hydrogen peroxide and 2 drops of povidone iodine, okay? And just use that and use it to nebulize with it every hour if you need to, okay? And that can address the cough that is very persistent in this disease.
So thank you, Bhan Prasad garu. So maybe Mukesh Chandra garu, at the end, I'm going to display helpline numbers, and for any guidance, you can just contact those numbers. We'll definitely help you out. Okay. So, sir, here is one of the question: how eye infection or eye redness is related to COVID?
Well, you know what, this is the COVID causes a lot of symptoms. Okay, these symptoms are very varied. Some cause some experience GI symptoms, some experience eye redness and conjunctivitis. So eye redness, and also there are in little children there are rashes throughout the body. So any of these can be if you have COVID illness, any of these can be you can experience any of these symptoms. So if you have eye redness in the early stage of the illness, don't fear that it could be black fungus. So it just it just may be a symptom of early stage COVID.
Okay. One more question: how many days should be in isolation? When should stop taking D3 after recovered from COVID?
Okay. So this is a good question. Isolation. If you are in the same household and if you get COVID, and isolation is meaningless if you ask me. Okay, isolation from family members is just absolutely meaningless, because by the time you're tested positive, okay, everybody in your household has been exposed to you. Okay. And there is no way to prevent illness. After getting the positive test, just isolating yourself in a small room and isolating somebody, a loved one, to a small in a room, and just throwing some food and water every now and then is cruel. They need to be taken care of properly. If they have severe symptoms, they need to be taken care of. And don't put people in isolation in your household. In my opinion, there is no need for that. And also, when do you stop vitamin D? So vitamin D is important. Constant administration of vitamin D is important. Periodic administration of vitamin D is important in active phase of the illness, which may last 5 days. Okay, and after that, go down to the maintenance dose. Okay, and also there are what you must realize is there are post-COVID reactions. Okay, and which can happen, which can once patient recovers and discharged from the hospital, even without vitamin D, and they can come home and start experiencing this racing the heart rate. Okay, and if that is the case, then you must conclude that that person is experiencing this post-COVID symptoms, and post-COVID symptoms can cause same amount of damage to the lungs, okay, as the active phase of illness. So even in the post-COVID, I think proper pulsing of vitamin D is important. Proper constant vitamin D supply is important to calm down these immune reactions. But after 5 to 7 days, you can come down to maintenance dose of 10,000 units a day or once weekly dosing.
Okay, here is one more question. So does too much vitamin D cause toxicity? Some are saying how much amount of vitamin D take per day?
Okay. This is a very good question. See, the thing is, in the first phase, we were able to control symptoms in most people with 3 to 5 doses of vitamin D per day for 4 or 5 days. Okay, but during this second wave, okay, the immune responses or immune reactions are so intense. Immune response of the body is so intense for whatever reason. Those doses were not enough. Okay, so in some people we had to use humongous amount of doses, because when the pulse rate is resting pulse rate is going up, okay, and to control that we had to give a lot of vitamin D. And have we experienced some adverse effects of vitamin D being high? Yeah, we did. Patient lived, and patient have survived, and patient this heart rate was it came down from 150 to as for some people it may have taken 1 or 2 days, and it came down. And after 5 or 7 days, patient completely recovered without even going to the hospital, without being admitted. We were able to preserve their saturations. Okay. But their calcium levels went up a little bit. Okay, just a mild elevation of calcium level, mild elevation of creatinine, okay, and which is being managed, and with proper fluid administration, those levels have come down, and in some people they are still coming down. So vitamin D toxicity is is not fatal. Okay, in past 35 years of medical literature, there is no fatality of vitamin D toxicity. So, vitamin D is, yes, can it cause adverse effects? Absolutely, it can. In high doses, it can. Okay, but what we need to, we do this cost benefit analysis with respect to with respect to the treatment that is being applied. Okay, whether did we save the person? Okay, is the person living? If the person is living, in very few people, this vitamin D, being very high has caused some problems, and those were able to be addressed properly, and they were able to be managed properly. Okay, and in most of the people where we are able to control their symptoms with 4 or 5 doses of vitamin D, for 3 or 4 or 5 days, there were no problems at all, no toxicity. Just their creatinine didn't even budge, didn't even go beyond 0.8.
So Archana Nimla garu.
Prakash, sir. Brother Prakash, I would like to add here.
Yeah, please go ahead.
Yeah. So regarding the toxicity, we have administered this vitamin D to so many patients. I mean, we have seen rarely any toxicity in any patient. Recently, we have administered almost 70 lakhs to a patient, 70 lakh of international vitamin D to a patient. And I am surprised to see his vitamin D to be 68. I mean, so much was used in the inflammation in his body. So we hardly see any toxicity. Usually it is seen in diabetics, any kidney issues, anyone is with kidney issues, usually you see. That point I just wanted to add actually.
Yeah.
So we rarely see that.
I also have something to add.
Yeah, please
Sorry.
go ahead.
So this vitamin D3 that's being given, that's being administered to these patients, we need to understand that there is a lot of oxidative stress in our body, and vitamin D3 is helping in restoring that oxidative stress. So there is our bodies don't have like a locker or a storage where everything just gets deposited and just causes toxicity. And even though if we use these huge amount of doses, for how many days are we using it? Only through the active phase of COVID, right? Once we are recovered, we are not giving those lakhs and lakhs of units the whole time. It's just for that recovery, for the patient to get recovered. And those doses of vitamin D3 that's being administered, it's helping in that oxidative stress. Nothing is being like deposited and causing toxicity. So I would like everybody to note this point, that yeah, from the patients that I have seen so far, there's no toxicity, and it helped the patient recover, and they're all on weekly doses right now. So just want
Thank
to
you,
add.
Priyanka garu. Yeah,
Yeah.
thank you, Priyanka. So Archana Nimla garu, you can ask your question.
Yeah. Good morning, everyone, sir. So, like, I'm a feeding mother right now. Like, I have a baby, 1 month old. So, how far, like, I can take a vitamin D3 tablets and all, doctor?
Okay. Have you taken prophylactic dose, Archana garu?
No, sir.
Okay. And do you know what your vitamin D level is?
Yeah, no, I don't actually. I didn't cover up
Okay.
that.
Okay. If you do not know your vitamin D level, and if you have not taken any prophylactic dose, I would venture to guess your vitamin D level is you may be deficient in vitamin D. Okay, and especially during in feeding mothers, and if the babies don't thrive, and that is due to vitamin D deficiency. And a lot of mothers who have not had proper vitamin D levels, they have other complications during pregnancy as well, and also with respect to their baby's development even after birth. Okay, so if that is the case, just taking prophylactic or just doses, like one capsule twice a day for the next 7 days. Okay, one capsule of 60,000 units for the next 7 days, and then going to weekly doses will bring your levels to a proper normal level. Okay, if you are if you are skeptical about that dosing, please get your levels checked. Okay, get a vitamin D level checked, and it's a very simple test. Just give a blood and give you a blood sample in the morning, and by the evening you will know what your vitamin D level is. Okay, that is 25 hydroxy vitamin D level. Get it checked, and then you will have a good idea where your level is and how to supplement.
Yeah, thank you, sir.
Thank you. So, sir, actually, some of the people are asking for the black fungus. So maybe we are almost done. It is very late for you, but let's take 5 minutes, then we will maybe wind up. So because some people are saying like, is it a new virus? And some people thinking like, is it because of we are not changing our masks frequently and reusing the same thing, and maybe that is actually causing a fungus. So is it because of a COVID? So there is a lot of confusion. Can you just explain us black fungus, white fungus, and there are many, even yellow fungus, which is so severe, people are saying. Can you just help us? And even some people are asking for the treatment as well for that. So is there any vitamin D3 also play a role in that? Can
Okay.
you please?
So, okay, the black fungus is an opportunistic fungus, and white fungus and other fungi are opportunistic organisms. Okay, which we are exposed to it on a daily basis. Okay, it is in our soil, it is in our air, it is everywhere, it is ubiquitous. Okay, but we don't get black fungal infections on a daily basis. Okay, what we are seeing, black fungus has been a problem and is continuing to be a problem in hospitalized patients who have been on COVID treatment for a while. Okay, so let's examine, okay, when these opportunistic infections are a problem in an immunocompromised host. So let's look at the treatment that we are giving to these patients. Okay. Extremely high doses of corticosteroids like methylprednisolone or dexamethasone. Yeah, what that does is it just suppresses the host responses, the immune responses. Okay, it just it completely makes the tissue not respond to any of these challenges posed by these opportunistic organisms. When a person is on these extremely heavy dose steroids for such a long periods of time, that is what predisposes a person to be prone to these opportunistic infections, and that is where the problem is. And also another problem is we are using not medical, most of the cases, not medical grade oxygen, but the industrial grade oxygen, where these oxygen cylinders have not been sterilized and oxygen supply is not properly sterilized. So that is putting this these opportunistic the spores into the tissues where these tissues are compromised. And also one of the other problems with these patients is their sugar levels are going through the roof. Okay? They're going very high, and you have sugar levels and you have the tissues that are not mounting any response, and that is a perfect culture media for these opportunistic infections to grow, and that is what we are saying. So black fungus is not a problem, in an ambulatory patient who is not on high dose steroid therapy, and even if you're just reusing the masks and those things, that's not a problem. But it is a problem in patients who are treated with extremely high doses of steroids for extended periods of time.
Yeah, thank you, Dr. Van Prasad. Maybe I just shared a screen, so where it's one of the YouTube video, and the doctor actually explained very well. He said like, COVID-19 and black fungus, he said like attacks lowered immune system. Steroids suppress the immune system. So that's what we actually talked about previously, right? So when steroids was given, good and bad, all the immune system, everything will be suppressed. That means there is nothing can actually, push the fungus outside of our body. So because it was suspended, and the fungus, opportunistic fungus, that will actually take over, and it will actually cause a lot of difficulty. So he explained very well. And humans after steroid use, especially in diabetes, so that's what Bhanu Prasad Gar also is mentioned. So I think this is where you can actually, I pasted this link in the chat. If you want, just go through that. I mean, this is the main issue. I mean, we have to, understand the steroids, the side effects that we are actually facing. I can tell you one of the case. One of our friend, he also, affected with COVID, and he was treated, and a lot of steroids were given. And after 1 month, he actually found like there is a swelling on his cheek. It was there in when the treatment actually going on. He thought like this is maybe a lot of medication went on, that actually slowly will get healed. But after 1 month, they're actually come to know that he has a black fungus, and that actually costed a lot for treating that. So I think he gave some, here. But if you look at the third point, vitamin D plus zinc is also helpful in treating this. But why don't we have to go that much of seriousness? I mean, with all these awareness sessions, what we want to tell you is take vitamin D proper levels, 80 to 100. Maintain that good amount of vitamin D. That helps not to get into that particular serious condition. And some people are asking, I'm not positive, can I take vitamin D? Definitely you have to increase. It's not only weekly once. For some period, you have to increase little high. Then you can slowly reduce and come to weekly once. That's what I think all these discussions finally leading to vitamin D maintain proper levels. So finally, I mean, any of you doctors, I mean, if you want to add anything, maybe we can wind up here. So then I can do some, 2 announcements maybe, so that we all can close the session.
No, vitamin D is important in modulating immune responses, whether it is fungal infection, bacterial infection, or viral infection. So, okay. And a cytokine storm is a reality in any of these infections, whether it is fungal, viral, or bacterial. So vitamin D is important in modulating our immune system. Okay. If having proper levels of vitamin D for longer periods of time will help your immune system to develop properly, to develop proper immune responses, and that is our only hope. Okay, whether in this pandemic or in this wave or the coming waves or coming pandemics. Okay, pay attention to your vitamin D levels. Okay, and go into the sun and eat proper foods, and just avoid all the toxic exposure that comes from a lot of grains that are sprayed with so many chemicals. Okay, and just go outdoors and go into the sun and take proper nutrition and maintain your vitamin D levels, okay, and improve your nutritional status. And that is our long-term, plan. That should be our long-term plan, everybody's long-term plan for a healthy and a happy living.
Yeah, thank you so much, Dr. Bhanu Prasad Garu. And I displayed helpline numbers. These are only for guiding you on, how much vitamin D that you can take in a severe condition. So, I mean, many people we are seeing like at the last stage or when the cytokine storm is very heavy, and that is the time where people are coming forward. So let's not delay it, because this is something very important. And please take these numbers. If you want a guidance, you can call us. And there are some of the incidents where some of the medicine is not working properly. So yeah, definitely some branded items you can take and near to your shop. And some people are saying we are not having a sufficient vitamin D tablets in our location. And I'm displaying one of the contact, and I think they're also giving some these medicines in courier. So maybe if you order today and tomorrow you will get it. So this is one of the helpful information. And the other information is we have all the live sessions, whatever actually we conducted. So those we are actually keeping on in the channel C/Life in God. And there are a couple of sessions done by Dr. Banu Prasad Garu in Temilios, C/Temilios Vizag, and even Rakshana TV also. I think they are the team where they started introducing these sessions, vitamin D3 and the importance of its role. So you can find in the YouTube Rakshana TV videos also you can find. So I think from today, I think coming week also Wednesday, we're going to have a session in English in the morning, 7:30 to 9 o'clock, and Saturday, 4 o'clock to 6 o'clock evening in Telugu. So those who want to join, please join, and please encourage your friends and circles, because you know the information, you got the information. Please pass on to the many people. That may be helpful to many people, right? So thank you so much for participating, and thank you, Dr. Banu Garu and Dr. Vijay Garu and Dr. Priyanka for sharing a wonderful information. So thank you so much. Here I'm ending the session. Thank you all.